Okay, good afternoon, and thank you for joining us again for the daily briefing on the City of Philadelphia's response to the COVID-19 pandemic. Today, our speakers are joining us again with the briefing virtually to adhere to social distancing guidelines. And we will begin, as we do each day, with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike. Thank you, Mike. Good afternoon, everyone. Members of Philadelphia City Council today received our revised fiscal year 2021 operating budget, 5-year plan, and capital program. The original budget proposal was announced just 2 short months ago. But as you are aware, the economic downturn resulting from the pandemic made this revision to the original spending plan necessary. This budget pares city services down to the most essential, imposes layoffs on hundreds of workers, and reduces or eliminates some programs that are simply no longer affordable. We created the spending plan by setting clear priorities. We'll keep all Philadelphians safe, healthy, and educated while maintaining core municipal services that our residents rely on daily. The budget eliminates a projected $649 million deficit created by lost revenue and other factors. That is more than 5 times the deficit that the city faced during the Great Recession 12 years ago, 5 times as much. So this budget proposed closing that gap with 3 key actions: spending reductions totaling $370 million, keeping a fund balance that is about $229 million lower than originally planned, and enacting revenue enhancements totaling just under $50 million. Additionally, we're proposing a change to the school district portion of the real estate tax in order to increase funding to the Philadelphia School District, which faces its own massive deficit. This will enable the district to avoid draconian cuts that we know will set our kids back years and harm the future prosperity of our city. Over the next 6 weeks, City Council will consider this spending plan, and I want to thank council members in advance for their thoughtful deliberations. There is not a single person, including myself, who likes this proposal. This is not at all what I envisioned for our second term. But in the face of a global pandemic and an economic catastrophe, we must address both with bold decisions so that this government operates within its means. At the same time, we must continue addressing other challenges like gun violence, poverty, and the opioid epidemic. We hope that by focusing on core services and maintaining fiscal stability, we will be able to rebound as quickly as possible. So I look forward to serious discussions with members of City Council as we transform our priorities to best meet the needs of Philadelphians, particularly our most vulnerable residents, under this new reality. Dr. Farley, please, with your daily update.
Good afternoon. Just a really quick update today. Our numbers are pretty similar to where they were yesterday. Since yesterday, we've had 660 new cases of COVID infection identified in Philadelphia residents, bringing us to a total of 15,137 since the beginning of the epidemic. Now, that 669 number for the number of daily cases is a high number. And that's because we've had many laboratory reports that came in today. More than 3,000 results, when typically we get in about 1,400 results a day. That increased number of laboratory tests in part reflects just a backlog of tests. We sometimes get that they'll clear out a backlog and we get a big batch in one day, but also partly reflects an increase in the number of tests being sent. And that's a good thing. We do want to have more testing. We expect that number to continue to rise over time. Still, as I look at the graph overall, I do believe that we are past the peak of the epidemic. We're on the decline, but the decline is really very slow. If you want to get a better sense of this, again, see our website for trends in the overall epidemic. We're continuing to see clusters in congregate settings. The situation with the city's jail is we currently have 58 inmates who are testing positive. That includes 1 new positive test since yesterday, 1 new inmate with a new positive test since yesterday, and 7 others who have recovered and been removed from isolation. In the future, we're going to be posting all these numbers on the jail at the health department's website. I won't continue to read them at the daily press conferences. Since yesterday, we have 31 new confirmed deaths from coronavirus infection, bringing us to a total of 638 since the beginning of the epidemic. See the graph on our website for trends and mortality as well. Of the 638 deaths we have so far, 353 or 55% are nursing home residents. Our situation in hospitals today is very similar to where we were yesterday. We have 976 people with this infection in Philadelphia hospitals and 1,812 in hospitals in the Southeast Pennsylvania region. And those numbers are very similar to where we've been about the last 7 days. The hospitals are able to manage that. They are busy, but they are able to manage that. Testing continues to gradually expand in its availability. If you go to phila.gov/COVID, you'll see links and phone numbers to the sites where you can get testing. There's one new site that I can announce today will be available on Monday. This will be at Sayre Health Center. It's a drive-up and walk-up site at 5800 Walnut. It's by appointments on Monday, Tuesday, Wednesday, Thursday, and Friday, but slightly different schedules on each day. The number to call is 215-474-4444 to make an appointment. All that information is on our website. Then just general messaging, the weather's looking nice. It's going to be more and more tempting for people to be outside. But I'm looking at those numbers of cases that we see every day. Everybody wants those numbers to go down to low numbers so that we can safely reopen our society and reopen our economy. The fastest ways for those numbers to go down quickly is if people follow our social distancing recommendations. Stay away from other people. Best way to do this is stay home. If you have to go outside, make sure you wear a mask at all times. www.phila.gov/COVID is the website. 1-800-722-7112 is the phone number for medical questions. Thanks.
Thank you, Dr. Farley. And now Armando will present the Spanish language translation of the mayor's and the doctor's comments.
Mensaje del alcalde Jim Kenney para el viernes 1 de mayo del 2020. Buenas tardes a todos. Los miembros del Consejo Municipal de Filadelfia recibieron nuestro presupuesto operativo revisado para el año fiscal 2021, el plan quinquenal y el programa de capital. La propuesta de presupuesto original para el año fiscal 2021 se anunció hace solo 2 meses, pero la recesión económica resultado de la pandemia hizo necesaria esta revisión del plan de gastos original. Este presupuesto reduce los servicios de la ciudad a los más esenciales, impone despidos a cientos de trabajadores y reduce o elimina algunos programas que simplemente ya no son asequibles. Hemos creado este plan de gastos estableciendo prioridades claras. Mantendremos a todos los habitantes de Filadelfia seguros, saludables y con acceso a la educación mientras preservamos los servicios municipales centrales en los que nuestros residentes confían diariamente. El presupuesto proyecta un déficit de $649 millones debido a la pérdida de ingresos fiscales y a otros factores. Esto es más de 5 veces el déficit que enfrentó la ciudad durante la gran recesión de hace 12 años. Tomando en cuenta esto, nos propusimos cerrar esta brecha con 3 acciones claves. La reducción de gastos por un total de $370 millones, el mantener un fondo aproximado de $229 millones menor de lo que habíamos planeado originalmente, y el mejorar los ingresos de la ciudad con un total aproximado de $50 millones. Las mejoras en los ingresos incluyen una revisión de la porción que recibe el distrito escolar del impuesto sobre bienes inmuebles, para poder aumentar sus fondos, ya que este distrito también está enfrentando su propio déficit masivo. Esto le permitirá al distrito evitar cortes draconianos que sabemos que afectarían a nuestros niños por muchos años, poniendo en riesgo la prosperidad futura de nuestra ciudad. Durante las próximas 6 semanas, el ayuntamiento considerará este plan de gastos y quiero agradecerles de antemano a los miembros del Consejo por sus deliberaciones tan bien pensadas. No hay una sola persona, incluyéndome a mí, a quien le guste esta propuesta. Esto no es lo que yo había imaginado para nuestro segundo mandato. Pero ante una pandemia global y una catástrofe económica, debemos responder ante ambas con decisiones audaces para que este gobierno opere dentro de sus posibilidades. Al mismo tiempo, debemos continuar enfrentando otros desafíos, como la violencia armada, la pobreza y la epidemia de opioides. Y esperamos que al centrarnos en estos servicios básicos y mantener la estabilidad fiscal, podamos recuperarnos lo más pronto posible. Así que espero tener conversaciones serias con los miembros del Consejo Municipal mientras transformamos nuestras prioridades para satisfacer mejor las necesidades de los habitantes de Filadelfia, particularmente las de nuestros residentes más vulnerables, bajo esta nueva realidad. Y esta es la actualización en materia de salud al viernes 1 de mayo del 2020. Desde ayer se han confirmado 669 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 15.137 nuevos casos en la ciudad. Hay una cantidad mayor de resultados que se reportaron el día de hoy, 3.000 resultados en contraste con los 1.400 que se reportan usualmente, posiblemente porque tenemos más centros de pruebas disponibles operando. Tenemos un caso positivo del COVID-19 entre los internos con un total de 58 casos registrados. Hay 7 internos adicionales que se han recuperado satisfactoriamente. Tristemente, también reportamos 31 nuevos fallecimientos en Filadelfia. Hay un total de 638 personas que han muerto por la COVID-19. 353 o el 55% de las muertes han sido en hogares de ancianos. Este virus no discrimina por raza o por género. Hay 976 personas que han sido hospitalizadas en Filadelfia y 1.812 personas en la región sureste de Pensilvania. La cantidad de pacientes hospitalizados ha estado dentro del promedio en los últimos 7 días. Los hospitales están muy ocupados, pero van atendiendo la cantidad de pacientes. Las pruebas siguen disponibles. Usted puede encontrar mayor información sobre estos centros en fila.gov/COVID-19 bajo la pestaña FAQ. Hay que asumir que todo el mundo a nuestro alrededor tiene el virus, incluyéndonos a nosotros mismos. Si no tienes el virus, no se lo contagias a nadie. Pero por favor, mantén la distancia social y quédate en casa. Si usted debe salir a trabajar o al supermercado, le recomendamos mantener la distancia social de 6 pies, usar mascarillas o máscaras de tela en lugares públicos donde sea difícil mantener las medidas de distanciamiento social y lavarse las manos apenas llegue a casa. Juntos podemos superar este gran reto. Gracias.
Great. Thank you, Armando. We're now going to move to the Q&A portion for members of the press. Please remember we have limited time during the briefing, so only one representative from each outlet is permitted for the first round, and reporters are asked to limit their questions to 3 or fewer. We will do a second round of questions as time permits. I also wanted to note that joining us today as well, in addition to the mayor, Dr. Farley, and the managing director, joining us are the finance director, Rob Dubo, and the city's budget director, Marisa Waxman, in case there are questions related to today's release of a revised FY21 budget and 5-year plan. First up today is Annie McCormick.
Hi, Mayor. My question for you is, at this point, do you think that you're going to be able to ask some of the unions to renegotiate any of their contracts? I don't know what the clauses are and the variety of contracts that the unions have. Being that this is so unprecedented, is that something that you're discussing and that is even possible?
We just ratified 1-year extensions with all 4 unions, and we will be starting up soon again on the future going forward, and we'll have different discussions based on our current situation. But going back and redoing doing contracts that have been already ratified is not possible.
Also, secondly, some critics so far, just reading what was released today, are saying that they feel that there needs to be a deeper dive into the individual departments and agencies across the city, and specifically talking about kind of the nitty gritty, the administrative things. It could be something as small as, a paper distributor. Do you know what I'm talking about? Like the administrative things that are in place.
I kind of know what you're talking about, but see, the issue is the critics have a right to be critics, but they're not have the responsibility of being mayor. And we've really attacked this problem in a really serious, thoughtful way to deal with all the issues we need to deal with at the same time, removing a $650 million deficit. I mean, we're talking 5 times 2008 and 9. So people will always be critical, and that's fine. They have a right to be critical. We have to deal with city council. If they have some different ideas that they want to implement that makes sense and that gets us where we need to be, we think we've taken a balanced approach to this. And if anybody thinks there's $650 million in efficiencies, they really don't know what they're talking about.
And just a follow up to that, would you consider this a starting point? And are you going to take into account maybe suggestions from city council moving forward? Because you did have a deadline as far as time restrictions in order to do this. So is it in a sense that you weren't able to do maybe a deeper dive that you would have liked because of the time restrictions?
We did a pretty deep dive. I mean, these department heads worked very, very hard along with our finance director and budget director to do what they needed to do to get this astoundingly high problem taken care of. Certainly council is our partner in this, and we are always interested in their ideas as long as they're feasible and they make sense and balance our budget and don't, reduce For example, don't reduce services to our school children. I mean, part of the problem here is keeping our kids on the right path and the right track. Because if we don't educate them and continue to make them progress, the long-term fiscal stability of the city and vibrancy of the city is in jeopardy, even beyond the pandemic. So I don't want to go back again to 2008, 9 and having all those cuts, all those reduced services, putting our kids as almost second-class students. We're not going to do that. And if people, are opposed to that or critical of it, then I'll take the criticism.
Brian,
and last question, I hope this...
I'm sorry, I didn't know if Brian wanted to add to what the mayor was saying. He jumped in here.
No, I just would reiterate what the mayor said, which was, every department head took a very close look at their budget. This was, as we're managing through an epidemic, we're also managing through a fiscal crisis that is almost impossible to imagine. For those of us who were here in 2008, that pales in comparison to what our departments were asked to do and the speed of which they were asked to do it. And I'm frankly very proud of what the work that they've been able to put forward. It was thoughtful, it was deliberate, and it maintains our core services. And we should be, these are incredibly difficult decisions.
Thank you, Brian.
I do just want to make one note is that we have 3 union contracts and we're still working on our 4th.
Thanks,
and what's
Brian.
the 4th one? Sorry.
EC 33.
Okay.
Thanks, Brian, and thank you, Annie. Let's go now to Jeff Cole of Fox 29.
Mayor, real quickly, we've certainly lived here a lot longer than I have, but I have a good amount. And
Jeff, can you speak up a little bit? It's kind of hard to hear you.
I'm sorry.
That's good. Much better.
Mayor, obviously, this is a city that can get really hot in the summertime. And there are lots of kids here who have no access to getting to the shore or pools outside the city. Why pools for kids who may not have any access to real water during the summer?
Well, we had 800 people that we had to bring on board in a short period of time. We'd have to start hiring the pool attendants and lifeguards now, which was virtually impossible to do. Secondly, we're not sure of where our medical situation will be when it comes to congregating at pools and swimming in pools. So in the light of the smaller time frame, we weren't able to put that together. And even if we did, we weren't even sure that we'd get medical clearance to allow the pools to open for people to be in close proximity to each other.
Mayor, do your budget reductions include any kind of imposed pay decrease for you or your top staff? And what you're looking at in terms of reductions?
Everyone making over $35,000 a year will experience a wage reduction from 1% to 7% based on their salary, and I'm at the high end.
And then finally, yesterday, Governor Murphy of New Jersey went to the White House, sat in the Oval Office, told the President of the United States that his state may take a $20 to $30 billion hit and that he needed federal aid just to keep fire and police officers on the job. He got no commitment from the president at all that there would be federal aid. You talk in your proposal that you're hoping to leverage federal aid. What makes you think you'll get any?
Well, Rob Dubois can expound on this, but this is stuff that's formula driven. We already received, I think, $276 million in reimbursements. Some stuff is COVID reimbursable, and Rob could be more specific. But what we put in there, we're pretty much recognize that we're going to get that. Now, the other stuff that we're trying to lobby when it comes to revenue replacement, that's still up in the air. But all the COVID-related things that are reimbursable through a formula are going to be reimbursed. So, Rob, you want to expound a little bit?
Yeah. What the CARES Act reimbursed is any cost that wasn't in our budget and is related to COVID-19. So we've put together a system to make sure we track those costs so that we can get full reimbursement. And as the mayor said, we have received the $276 million that's intended to reimburse our costs.
Thank you.
All right, thank you, Jeff. And next up, we'll go to Denise Clay of The Sun.
Good afternoon. My question, it's kind of a question that I asked during the briefing yesterday, but I kind of wanted to hear this from the mayor. From what we were told, you did a lot of this budget cutting with racial inequities in mind, in addition to some of the other things, but recognizing that not all neighborhoods are affected the same by this pandemic. Can you talk a little bit about your reasoning behind that, and what, I guess, and is that going to be something you take into consideration as you do future budgets once the pandemic is over?
Well, our communities of color are experiencing really heavy impacts from the COVID-19 based on a lot of things that have happened over generations of racial inequities in healthcare, where people have higher incidence of diabetes and high blood pressure and obesity, and are impacted more so by the virus than other folks, as we see by the death tolls and the hospitalizations. So when we talked about cutting things, we certainly didn't want to cut health centers, for example, where health centers are the lifeline for people's health in neighborhoods that are poor. We want to make sure we didn't cut EMT service, medical transport service, because of people utilization in neighborhoods who are poor. So we want to make sure that whatever we did in making these difficult cuts, we didn't want to super impact neighborhoods that are poor, that have experienced, again, long-term racial inequities.
Okay. Now, in terms of the poverty programs that were put in the original budget, things like the Cato Scholarship and other things, I saw that under the education part that those things will, and I just want to make sure I'm understanding this right, they will be phased in, but it'll be less than what you initially proposed.
I mean, Cato, for example, will be cut in half and instituted at a later date. We didn't cut it off altogether because we believe that more people that have degrees, associate and bachelor degrees in our city will thrive, will prosper as a result of that. And if we don't make these investments now, 7, 8, 10 years from now, we're going to suffer as a result of it. We wanted to make sure that our kids maintained, when they go back to school, that they're not facing all the draconian cuts that they went through back in 2008, 9, 10, to make sure that we can move forward while at the same time recovering from the $650 million hole.
Okay. Well, thank you.
All right. Thank you, Denise. Next, we go to Howard Monroe of CBS 3.
Yes, good afternoon, Mayor. With many businesses and construction sites opening back up today, how are you making sure that these guidelines that you put in place are being followed? And does the city have the power to shut these businesses and sites down if those guidelines are not being followed?
Well, first of all, on the larger construction sites and on those that we work with the building trades and the GBCA, which is the Building Contractors Association, a lot of these things were developed by them themselves. So I'm sure going to follow what they said, what they've recommended. We will have inspections. We will have people that are doing inspections, and we do have the ability to shut down work sites that are not complying. We find more difficulty with smaller types of jobs where people we'll make sure there's no more than 4 people in a residential construction project at one time, and we'll have to continue to maintain vigilance and shut jobs down when they need to be shut down. But I expect that on the larger, more organized jobs, they'll somewhat self-police, but we'll make sure we keep an eye.
And how will this going forward? Will you be looking at how this is going in terms of any spikes in cases or any more deaths, and then seeing if this can go any further, or how will that go?
I don't expect the construction is going to create spikes in infection or death. What I worry about is this weekend when people are out there in the warm weather, not wearing masks and not distancing themselves from other people. That's the real danger for a spike that would put us back behind the 8 ball again, is people's lack of concern or lack of maturity when it comes to their interaction with people, especially on warm days. I know everybody's got cabin fever and people want to get out and they want to exercise, and I totally get that. If you can't put a mask on, I mean, what are you saying about your attitude towards your fellow man and women and your city and its citizens? So just put the mask on and stay 6 feet apart, and that'll keep the spike from happening.
Mayor, thank you.
Thank you, Howard. We go to Jason Peters of Philly Weekly.
Hello, just wanted to ask two quick questions about the prisons. Do you have the total number of inmates in the city's prisons that have been tested?
I believe it was around 240, but we'll get you the exact number.
Okay, and then the second question is following off that. Do you have the updated cumulative positive tests from the prisons?
Cumulative is 192.
Got it. That's all for me.
All right. Thank you, Jason. Next, we go to Laura McChrystal of the Inquirer.
Hi, my first question is for Dr. Farley. You mentioned today the big batch of test results and that could be a sign of testing increasing in the city. Could you expand on that? How much of that do you think might be attributed to increased testing versus a backlog in the labs?
Well, you can look at our website and see the number of tests that are done by day. And you can see that we were one time maybe 1,200, 1,400, and now we're maybe 1,600. There was one day we have over 2,000 tests. So clearly we are seeing an increase in that. But we reported 3,000 tests today. So certainly I would say the large majority of the increase is just reporting the backlog. But some of it is the overall increase.
Okay. And next I have a question for the mayor. Some city council members have already voiced concern about the tax hikes proposed in your budget. What would your response be to that if there's really not an appetite for tax hikes?
First of all, my response is, and this was made evident in your coverage of the issue, the $650 million in problem, $50 million is only is taxes. So $600 million has been dealt with, at least from our proposal, through cuts and layoffs. So it is not heavy. It's taxes. No one ever wants to pay taxes, but this solution is not tax heavy. It is tax related, but it's also cut related. It's also layoff related, and it's also program changing related. And again, I respect, no one. Anytime I've had to vote for taxes, I've done that. And I understand the consternation that people may feel. But if you want to balance that tax increase for the school district against the cuts that we'd have to make next year for our kids, then those who don't want to vote for taxes should come up with another solution to see if that works. And we're open-minded and open-eared.
Okay. And lastly, a question about the beverage tax and the programs that it funds. I understand that pre-K and community schools will be kept level and just not expanded, right. But I saw there's also a projected significant decrease in beverage tax revenue. So will those programs still be funded by the beverage tax, or does that revenue no longer cover those programs?
It's still. Well, I'll let Rob talk about the details of the tax. But we are keeping pre-K at its current level. Again, this is another example of investment in our future, an investment that will reap benefits going forward, to have these children that are going to go through this process and get a good education and graduate from college, or go on to something profitable or positive. If we don't do that now, if we cut all that now, these kids will be drifting, and dealing with our issues in the future will be impossible to deal with. And the same thing with the community school model, especially now in the middle of this pandemic, where kids even need more attention and more food and more clothing and more other types of things they need to survive. We didn't want to cut that. We couldn't obviously afford to expand it, but Rob could talk about the tax itself.
Yeah, and in 21, the tax is projected to be about $72.5 million. Which is a little lower than this year, but it's not a dramatic fall off. So we still think that revenue will be sufficient to fund the programs next year.
Okay, thank you.
All right, thank you, Laura. Next is Kennedy Rose of the Philadelphia Business Journal.
Hi, everyone. I have a question for either the mayor or Brian. Business leaders expressed concern earlier this year that the business climate was not favorable for attracting businesses and workers. And I was wondering, how did your team weigh those concerns as you constructed those tax measures?
I think it's more Rob should answer that initially.
Yeah. So whenever you put a budget together, you're weighing different things and making trade-offs. You don't want to raise taxes, but you also don't want to cut the services you're providing so deeply that your city is no longer attractive. So it's always that trade-off. And as the mayor said, most of how we got to balancing our budget was through expenditure reductions. We didn't want to go so far with that, though, to really undermine the quality of life in the city.
But additionally, over the course of the last 4+ years, we've been successful in attracting companies and retaining companies and having companies expand in the city. So, it's never perfect, and we never have enough jobs, but I don't think we were in any dire crisis before this hit. There's a number of companies we retained and attracted, and I think we were holding our own.
Okay, thanks very much.
Thank you, Kennedy. Next, we'll go to Martin Pratt of YBN.
I have two questions, and thank you for this process. Very transparent. The first question is a similar question to I asked last week. I guess a couple of people contacted me and wanted more clarity. I was asking, will there be a self-quarantine strongly recommended or mandatory for people who come to Philadelphia, specifically from states where the curve is not flattened?
I doubt it. Right now, Philadelphia has one of the highest rates in the country. And so I think it's kind of inappropriate for us to worry about us importing the infection from elsewhere. We have infection everywhere in the city right now. So you're asking a hypothetical about some situation in the future where we have almost no cases and there's a big outbreak elsewhere?
Well,
according to New York Times, I think it's unlikely we'll be there.
Well, according to today's New York Times, we actually are in the city, the realm of the cities that are flattening and going way down comparatively to, I think it's 12 states that are increasing.
Again, I would say I think it's going to be unlikely in the future where we would have very low rates and there would be very high rates somewhere else. If we do get to that point, why don't you ask me that question again?
I also don't understand how we would identify folks. I mean, someone drives in their car from Ohio. I don't think we have the authority to pluck them off the street and put them in a hotel and force them to be there for 2 weeks.
Well, Mayor, you did that when you talked about New Yorkers. You did say we are strongly recommending New Yorkers.
Yeah, recommend.
Travel to New York, right? And that's what I'm asking. Are we?
Yeah, recommend.
Okay.
We recommend that everybody do safe things. It's just the problem is not everybody follows the recommendations.
Okay, got that. And then, Bryant, question regarding the trash pickup, and I know the mayor did talk about that this Monday. Are we looking at any kind of campaign or any kind of informational telephone number that people can call to say, this building, I'm standing in front of the building, and this building has had trash out for the past 2 weeks?
Call 311.
Okay.
Yeah,
thank you.
That's still the number to call to report those types of things, and we'll certainly respond to the best of our ability, given the staff we have on staff right now.
Got it. Thank you. That's it.
Great. Thank you, Martin. Next, we go to Argenis Figueroa of Univision.
Good afternoon, Mayor. I have two questions. I would like to have translation in Spanish, please.
Claro que sí, Argenis. Buenas tardes.
Buenas tardes, Armando. Gracias. Mi primera pregunta sería, de todos los ajustes que han hecho al presupuesto, ¿cuál sería el sector afectado?
Of all the adjustments that have been made to the proposed budget, what would be the areas that's most affected?
Areas that's most affected would be the employees that we have to lay off. That's the hardest part. The hardest part of this budget has been having to tell people that they're going to have to be laid off. And it's really heartbreaking, and it's very difficult. And that's the largest part of our cost is our salaries and benefits for our city employees. And it's just heartbreaking to do it, but we have no other choice.
Lo más duro va a tener que ser el tener que cesar a los empleados y decirle a la gente que tiene que irse porque esos son los costos más altos para nosotros, los salarios y los beneficios de nuestros empleados. Aunque nos parte el corazón hacerlo, vamos a tener que hacerlo.
Okay. La segunda pregunta es, entendiendo la necesidad de reducir esos gastos, ¿cómo creen que se vería impactada la comunidad en general, sabiendo que pues, la alcaldía aumentará algunos impuestos y la calidad de los servicios va a disminuir?
Y la pregunta entonces es...
Eso, ¿cómo cree que se vería impactada la comunidad?
Okay.
Sabiendo que aumentarán los impuestos y disminuirá la calidad de los servicios.
Understanding that there's a need to reduce the costs, what will be the impact in the community given that taxes will have to go up and the quality of service will come down?
Well, we're trying to balance both minimize the tax increase. The tax increase on real estate is under 4%, and it's going to the schools directly. So it's going to continue to keep the schools moving in the right direction. We're trying to balance our service levels. We've kept on board things like recreation centers and libraries. We're not laying off police officers or firefighters. We're keeping fire stations open, police stations open, and we're trying to do and all medic units, our paramedics none of them are being laid off, and they'll all be full service. So there'll be some reductions or some adjustments when it comes to things like trash pickup and recycling. We'll see that as we move forward, what that means. But we're trying to maintain a good level of service based on the mountain of problems that we're facing.
Bueno, lo que estamos tratando de hacer es algo balanceado. Vamos a tratar de hacer que el aumento de los impuestos no afecte mucho porque tenemos servicios que tenemos que cumplir. Por ejemplo, el impuesto a los bienes raíces que se va a elevar por debajo del 4% va a ir directamente a las escuelas. Nosotros no vamos a cesar a los policías o a los bomberos o vamos a cerrar las estaciones de policía o las estaciones de bomberos. Vamos a también mantener los servicios completos de los paramédicos. Vamos a tratar de hacer reducciones, obviamente, en los centros recreacionales y en las bibliotecas para mantener un balance y se va a ver, por ejemplo, una disminución de la frecuencia del recojo de basura y de los reciclables para tratar de hacer estos cambios lo mejor posible.
Okay. Muchas gracias, Armando. Thank you, Mayor.
Muchas gracias, Armando.
Great, thank you. And next up is Jake Blumgart of the New Statesman.
Hi there. I just had a quick question for you guys. I know there were a few programs that were kind of outlined in the Inquirer's reporting and whatnot that were getting canceled, like street sweeping or expanded street sweeping and stuff like that. And I was wondering, there were a couple programs you guys rolled out at the beginning of the year in terms of support for renters. There were two separate and distinct programs there, and I was wondering if those were also being curtailed due to the extraordinary budget constraints the city is now facing.
Rob, you want to take it?
Yeah. So they're being restructured a little to ensure that they're tailored to what's going on with COVID-19, but they're still going to be in place. And actually what will happen is we'll use federal money to help supplant city money for those programs.
Interesting. What federal streams are you guys looking at?
So we're looking at CDBG money and some of the money under the CARES Act, but Marisa can add more details if I've missed something.
Marisa?
So we're looking at, there's a funding stream called ESG that supports homeless services for assistance and prevention, but also, as Rob mentioned, the CDBG increased dollars from the federal government will be used to launch those PHL rental assistance programs and supports.
Okay. Are there any other programs that you guys could name that are being curtailed? I wanted to highlight a couple other things that the city was having to scale back on.
So the mayor talked before about the Cato Scholarship.
Right.
So that instead of starting in the fall, will start in the spring.
Right. I got that.
And because it starts in the spring, when there are fewer students, there'll be a lower cost.
Right. And I saw like the opioid response stuff is getting scaled back to some degree. But I kind of meant anything else in addition to what's already been reported.
We certainly can't speak to everything that's been reported, Jake. If you have a particular point in mind, we can speak to it.
Okay. Yeah, I think that's it for right now. Thank you.
All right. Very good. Next is Layla Jones of Billy Penn.
Hi. Could someone please break down the reimbursements that the city has already received so far? I'm just wondering what departments or programs they came from and what exactly they were used for.
So we've received $276 million from the CARES Act. And the way that works, though, is now as we spend money, we'll have to show that it qualifies for that. So, for example, the surge capacity at the Layla Center, that's something that will be reimbursed. The hotels we set up for quarantine sites, that will be reimbursed. The acquisition of protective equipment, that will be reimbursed too. So there's a wide variety of things that will be reimbursed with the money that we've received.
You good, Layla? Layla, I'm sorry, you were unmuted there. You were muted.
Okay.
Go ahead.
Yeah. How much did the Layla Center end up costing?
We'll have to get back to you on that.
Okay. Thank you. That's all.
Okay. Next is Pat Loeb of KYW.
Thanks, Mike. Is there a final number yet on layoffs?
They can. The finance people can talk about that more in depth, but we don't know. We don't know yet because we're still entering the financially, and we won't know what comes off the back end based on what happens with whether there's a surge, whether we can open sooner or later. Those kinds of things are all variable, and as we move forward, we'll get a clearer picture of where we stand.
Okay, thanks.
Yeah, and we're working.
Sorry, go ahead, Rob.
Yeah, and we're working with departments to hit position numbers, and if they can get there through not filling vacancies rather than layoffs, that's better. So we're still trying to work through those numbers with departments.
Thank you. Understanding that nothing can be done about it now, in hindsight, was it appropriate to give raises for those contract extensions?
Yes, because these people that are on the front line of this scary, dangerous, life-threatening situation. And if we expected people to come to work every day and to carry people's, into hospitals, and deal with crime on the streets, and to deal with even the stuff like trash pickup, we had to compensate them fairly. The other issue is we didn't have the time or the attention to be able to negotiate a 3 or 4 year contract with these unions because we're in the middle of a medical and financial crisis. So I don't know, Rob, what those contracts amounted to from an additional cost, but we had to deal with people who we needed to depend on to get us through this medical and financial crisis.
Yeah, and the other thing, we had set up a labor reserve with funding for the contracts, and the cost of those contracts would come in below what that labor reserve was.
Okay, so it's not like dollars for those increases then have to come out of the general fund and will lead to the layoffs that you'll have to make. It was not a trade-off like that.
They will be paid for out of the general fund, but we had money set aside for them.
Okay, thank you.
Thank you, Pat. Let's go to Jenny DeHuff.
Thanks, Mike. I guess following up on Jake's question earlier, will any other areas of the budget or benefits that city employees enjoy, such as city-owned cars, or, for example, will drop, ever be looked at as a potential cut to help ease the budget in the future?
Rob, could you explain what drop really is?
Yeah, so DROP is a retirement program. It lets employees basically sign up to leave at a particular date, and in exchange, they start receiving their pension payments as though they had retired while they're still working. The impact on the pension fund really depends on a number of things, including what that ability to enter the drop does for retirement ages and what it does for the amount of benefit that an employee will receive.
Okay. Unrelated, related, but will the offices of the city representative, arts, culture, and the creative economy and workforce development be eliminated or reduced?
Ryan?
They're being eliminated, and some of their functions are being absorbed into other portions of the government. As an example, the Office of Arts and Culture, some of those functions will be absorbed into the Managing Director's office, the Office of Workforce Development. Some of those functions will be absorbed into the Commerce Department, but the offices themselves have been eliminated.
Okay, thank you.
You good, Jenny?
Yes, thanks.
All right. Last call for questions. Right now we have Martin Pratt. Let's go back to Martin of YBN Philly.
Yes, the mayor just mentioned recycling and cuts. And so can you get a little more in depth, maybe Rob, into what exactly is going to be cut from recycling? Are we talking about recycling pickup? Are we talking about the Philadelphia Energy Authority programs like the solar program? What exactly is recycling?
Ryan?
Yeah, sure. So the recycling, so the solar program has received some cuts, although it was not eliminated. Marisa, correct me if that's incorrect. But, and then on recycling itself, I think we're still working through what our sanitation collection is. Obviously, we're still having challenges making sure that we have enough staff. So we're still on a every other week recycling pickup program that'll last at least until May 15th and possibly longer, depending on whether we can get enough staff here as they try to balance both work and their at home lives with kids at home from school, et cetera. So I think that is still something we're reviewing and trying to understand that if that's a long-term issue or if that's something that will go back to weekly, but it is funded for weekly.
Okay. And the second thing, Brian, I'm not sure if this is you or Rob, but have there been any outreach to private sector to supplement some of these cuts? Has there been any conversation or is there appetite for a conversation with, let's say, I don't know, Comcast, but, some other private sector partners so that we can buttress some of these cuts?
Rob, I don't know if you want to, I think you're probably referring to payments in lieu of taxes or something to that effect, or additional contributions from corporations. Rob, I don't know if you want to take that. I can take a shot at it, but.
Yeah, and there's been work with philanthropy, and there's been a philanthropy set up a couple of different funds to help pay the costs of, for example, helping fund nonprofits, helping provide funding for a couple of different areas, but not for kind of daily operations of the government. That usually won't happen with philanthropy.
Are you good? Let's unmute you there. Hold on one second. Martin, you're still muted. There you go.
Okay.
Are you set?
Yeah. The question I was going to specifically what I was talking about was pools. So with the pool, is there a conversation being had about maybe sponsoring?
So I'm gonna jump in here now. So the mayor said that it was partly because of health reasons. We provided direction to the Parks and Rec to stop planning for pool opening because of health reasons. Pools will not reopen this summer, even if there's fundraising. This is much more than a funding issue. It's really about a health related issue and some logistics.
Okay, thank you. That's it.
Yep.
Great, thank you, Martin. And seeing no further questions, that concludes today's daily briefing. Thank you for joining us. We will do these daily briefings next week on Monday at 1 p.m. Thanks.